Well, as you may or may not know, September is Prostate Cancer Awareness Month. It's a very treatable disease at times, very misunderstood at other times. And if you're just joining us, maybe new to the program, you may or may not know that I'm a prostate cancer survivor. So I'd love to talk about this topic. Dr. Reza Shirazi, my friend here, joins us here once again this morning. It's been almost a year, I think, since we talked last time with Genesis Healthcare Partners. You guys really are on the leading edge of how to treat prostate cancer.
Thanks again for inviting us to be present, and I'll be happy to talk about some of the new advances we have since last year.
Let me reset the table and talk about my case briefly. I'm a very early detection case because of family history and some other medical things going on. I was very fortunate in that it was detected at a very, very early stage. At the time, my options I thought were kind of limited, so I opted for a radical prostatectomy. That's pretty serious surgery at that point with some consequences and side effects. You say there are more options now, though, than just 6 years ago when I was diagnosed.
Absolutely. You know, as the field of technology advances, it introduces new options for us. Since 6 years ago, we actually have ways of treating this with robotic, not surgery, robotic radiosurgery.
Yeah, they had the robotic surgery
at that
back
time,
then,
correct.
but not the robotic radiation treatment.
Exactly.
So what makes that different?
So CyberKnife robotic radiosurgery, it has the word surgery in there, but we actually don't make any cuts. It's x-rays precisely focused at the area where the tumor and actually the prostate is, and treating it with sub-millimeter precision, just like a surgeon's hand were to cut the prostate. We target that area precisely without making any incision. It's x-ray beams that comes and focuses and targets the prostate accurately, meanwhile sparing the bladder, which sits in front of it, the rectum, which is in the back of it, protecting the neurovascular bundles, and maybe even cooling off a little bit on the urethra as the urethra exits.
Yeah, the prostate is sitting right in the middle of some very vital organs and tissue and so forth that you don't want those other tissues or organs damaged if at all possible. And I know surgeons go to great lengths. They do the very best they can, but this new technology gives them a new tool.
Correct. Just another tool in our arsenal how to attack this. It is not right for everybody. What I'm excited to share with you is, since last I was here, early prostate cancer, which was your case, CyberKnife radiosurgery was an option, and we have one of the largest national protocols from our center, and if you go to cancer.gov, it's one of the ones people can enroll in other states. However, since then, for even more aggressive, what we call high-risk disease, we do have a protocol through us and UCLA, which is available. People that have more advanced Gleason grading, more advanced disease that previously we were not able to do with CyberKnife radiosurgery, we can now offer that, as well as people that previously have had radiation, but their disease came back for some reason or another. They might have had old school radiation 20 years ago, etc. We now have a recurrence protocol, and those people we can retreat with radiation, which is something unheard of. We typically don't want to play the same card again, but we have had quite a number of patients now treated on that, and we presented that paper in one of our national meetings since last year.
These are huge advances, like we say, and I mean, I look at this and with mixed emotions. I'm thrilled for the people that can take advantage of this. I'm a little bit sad sometimes. I think, oh, you know, if that had been available back then, I'm sure I would have opted for something like that. It's really treatable. And this is what I try to tell men. I say, you know, you don't really want to get your exam. You don't really want to, you know, get too deep into this unless you feel you have to. But when it's early detected, it is so treatable. There's no reason for prostate cancer to be killing the number of people that it kills.
As you said, early diagnosis saves lives. It's the most common cancer in men outside of skin cancer. Fortunately, it is not the deadliest. About 200,000 cases per year. It kills about 27,000 or so in the last data. But if you diagnose it early, options are much more. In the old days, when we didn't diagnose it, men would come with very advanced disease. The disease had metastasized. Right. Unfortunately, at that stage of the game, it is not a curable thing.
And when we say metastasized, that means it's spread to other parts of the body?
That's exactly. Okay. Gone outside of the bed where it resided, and it's gone to other areas.
Because if you contain it within the prostate, that's this little small gland. it's very containable.
Correct.
If it has not escaped from the prostate.
Localized prostate cancer with aggressive treatment, various options, including surgery, non-surgical radiation, robotic surgery or radiation that we talked about. We're talking about cure rate of 93 to 95% for early stage disease. A little bit more advanced, the cure rate is not as good, but we have vast majority of options. I'm so excited to be in this field at this time. We even have vaccines now. We have treatments that wasn't available when I started my training, which wasn't a huge number of years ago.
Well, you want to get in touch with Dr. Reza Shirazi, and that's at Genesis Healthcare Partners. And the website, by the way, is mygenesishealth.com. Mygenesishealth.com. Guys, get information. Women out there, get information for the guys that you love and care about, and make sure that they get their exams and then their follow-ups if necessary. Doctor, it's great to see you. We're going to talk to you more during the month that is Prostate Cancer Awareness Month. So
thank you.
We just kind of did the overview there this morning for everybody. Thanks so much for coming in.
Thanks, Ryan.